This is not your NBC. This is CAN TV, Channel 21. And this is the Black Star Still Rising program hosted by Stephen Silver Carter. I've got a guest here. It's going to blow your mind. And I'm going to do things a little bit different today because I want all of you who don't have a pencil and paper handy to get a pencil and paper handy because you're going to want the information that we're going to give you throughout this day. Okay. First things first, let's get the credits rolled. I do roll the credits ahead of time. I want to give the credits, first of all, to Brother Philip Jackson, the late Brother Philip Jackson, who was the founder of the Black Star Project and who has been succeeded by his beautiful sister, Gloria Smith. Got to give thanks to them because we would not have a show here if it was not for Black Star Project being our sponsor. Also, got to reach out to the man that makes all of this possible, and that is Darius Hillman, the executive director of CAN TV. He is somebody who's been so mindful of the importance of community organizations having a voice, having something like this program, to present issues, things that for the benefit of the community. Cannot do this without somebody in that booth. Wave, Imani, and Rocio, wave. Okay, we're there. We're in good hands now with them in the studio, all right?
All right.
And I cannot do anything more without saying something about the people at my group that puts me together. And that's my associate producers, Dr. Mike Washington, and also the other associate producer, and that's Ellis Taylor. So you've got this, we got the cameras rolling, we got some things, and we cannot forget all the volunteers. That's going to be an important part of our discussion today, what volunteers mean for nonprofit organizations. So Deacon Price, Pam, Brother Tree, Roundtree, Cortez, Lindsay, you folks down at the Black Star, you keep it going. Thanks for having you a part of it. Had a special guest. Special in so many ways. Special because we what? This my alpha brother, who has seen me through some good times, and because of him, I got a chance to see Lionel Richie at the Kennedy Center. That's the story I tell about him, how famous he is to me and what he did to make things happen. I got so excited in reading about some of the things I didn't know about you. And I said, I better do this. I don't normally do this. Can I get you to come back again? Now,
Absolutely.
you don't, oh, I can get you now?
Let's do it.
Oh, man. Because I can see right away that the things that we'll be covering today, Joel, that we don't have time to do all. We're going to give it a good shot. We're going to try to emphasize the things that our audience is mindful of and what I've been seeing in the calls and the letters that we get. I want to talk about that. But first of all, besides being a member of Alpha Phi Alpha, how many years?
35 years.
35.
35 years.
I got 30 on you.
You got a couple. You got a couple.
I got 65 years in. But he is an HBCU person.
That's right.
That's part of his claim to fame.
Florida A&M University.
Florida A&M. Did they ever sign or something?
The Rattlers.
Okay, very good, very good. And we've had some outstanding HBCU folks on the program, and it shows that DEI works for everybody.
Absolutely.
My surgeon, Howard University, DEI. No, she wasn't DEI. She was ahead of her time in many, many respects. Joe, tell us a little bit about your organization and maybe a little bit more about your background, how you came to these moments that we'll be talking about.
Absolutely. Well, first, thank you for having me. Again, my name is Joel Johnson, and I'm honored to serve as the president and CEO of Treatment Alternatives for Safe Communities, known as TASC. TASC.
TASC.
Absolutely. So TASC is a nonprofit. We serve statewide in the state of Illinois. And we really are, we exist at that intersection of behavioral health, which is mental health and substance use, and the criminal legal system. So we are embedded in all 102 county courthouses throughout the state, and we work to move people into treatment as an alternative to incarceration. We believe that there's a large part of the citizenry who may have crossed the line with respect to law, but in many cases, substance use or a mental health crisis may be at the root of what brought them to the attention of the court system. And so we think that they and society would be better served if we move them into treatment and allow the carceral system to work for persons who may have offended more egregious crimes.
I'm going to hold you here because these you hit that. We talked about talking points. Certainly what you've hit, and we're going to hit them more over it. But I've got to say this about my guest, about Joel. He's an advocate.
Indeed.
He's an advocate for the things that the community needs.
Absolutely.
And has to have. And that's part of his claim to fame because he got that honest too. Because what do we say about Alphas? First of all, servants of all, we shall transcend. We are servants, and I want to emphasize that. Part of what you're watching is we want you to become advocates. You folks who are watching out at the Atlas Center, at Croc Place, all these folks, please start to think about what you can do, what you can contribute, how you become healthier when you can contribute to something like the program that Joel's going to be talking more and more about. So, volunteerism is important at the Black Star Project, and that's why a little later on we're going to be telling you which phone numbers to call so that you can be an advocate and a volunteer and make yourself healthy. Those folks that have retired or folks who've got some time on their hand, I know we're going to talk about that, but another thing that I liked what Joel has said, he's going to talk about the collaboration of nonprofits.
That's right.
Not a rivalry of nonprofits. That's such an important thing that you recognize and we'll be talking about too. So I'm going to turn it back to you. Talk about your mission.
Sure thing. So TASC, we believe in building a healthier, safer, more just society. And so again, as an alternative to incarceration, we work with law enforcement and first responders across the state to get people into treatment before there's an arrest. And we also work with the population returning home from carceral settings, helping them re-enter society. And we provide them with supports, wraparound services,
what's wraparound services?
Wraparound services are really addressing those social determinants of health. If they need housing, if they need employment security, if they need food security, we're helping to plug those holes beyond
Maslow's
hierarchy of needs.
Hierarchy of needs.
That's right. And so, in order to be self-actualized, you got to be able to eat. You got to have shelter. You got to have clothing.
I mean, they can't do anything if they don't have food, shelter, and clothing.
They can't do much.
They can't do much. We'll go back to jail.
That's right. They're starting with a deficit. And so we help plug those holes to keep people in community, working with families, and that is a part of our full operation of services. We also provide technical assistance and training to jurisdictions not only across the United States, but internationally. We help train people on our model of alternatives to incarceration. We currently have active technical assistance in Africa and Europe.
Tell us about that, a little bit about some of your experiences in that. Those are great stories. Go ahead, please.
Our staff have engaged other states, the state of Oregon, the state of California in the last 12 months, Peru, Tanzania, Kenya. And the UK, we are technology is great. Sometimes staff go with boots on the ground, but we use technology and help people understand that their society could be better by moving people into treatment as an alternative to incarceration. And so that's a big part of what we do. Our practice, our technical assistance, and then policy development. We help advocate for things that we think will improve society. So eliminating cash bail, we were part of a coalition of organizations that really led that movement.
Down in Springfield. And nationally too.
And now that we've eliminated cash bail in the state of Illinois, we're working to roll out pretrial services. So engaging people, now that they're home, they're not spending time in any one of the county jails waiting for their trial. Now we can get them into treatment while they're in community. So when they do go to trial, they are on the path to independence and healing.
Let me stop you just for a brief minute. Give folks, and I told you, better write this down. Viva Voce, you got to pass it on. You got a phone number or email or whatever that folks who want more in-depth information,
Absolutely.
or want to volunteer, or want to contribute. So give them a number.
Absolutely.
And I'm going to repeat it when you say it.
Yep. I want to direct people to our website,
Okay.
and that's www.tasc. That's TASC.org. www.tasc.org.
You're going to hear it again, so he's going to repeat it again, but get your pencil and paper and start to call somebody and tell them they need to be listening to this program. Go ahead.
All right. And so www.tasc.org. And that's the best way to contact us, and we'd be happy to get you connected, learn more about what we do, and if you're in need of supports in the city and across the state of Illinois, and even outside the state of Illinois, we're able to help connect you with persons and organizations that can help you.
Can I get you to hit on one of those things that I guess I'm more dear to me that I've been talking about? You talked about protecting Medicaid.
Yeah.
That was one of the bullet points.
Absolutely. So we know under our current federal administration, there's this big beautiful bill that they're talking about, which is this budget reconciliation package, and it is proposing significant cuts to Medicaid. In the state of Illinois, about 3.4 million people are recipients of Medicaid.
Did you hear that? 3 point how many million?
3.4 million people in the state of Illinois alone, which is a little more than 25% of our population, are on Medicaid in Illinois. And Medicaid is essentially insurance for low-income population. About 68% of people in nursing homes are on Medicaid. Half of all HIV patients are on Medicaid. Medicaid traditionally was the low-income insurance for single mothers and children, and with the Affordable Care Act, Obamacare, it expanded Medicaid to cover non-childbearing adults. So, men ages 18 to 64 also are eligible for Medicaid under the expansion, and so
Millionaires don't need Medicare, do they? Billionaires,
men,
millionaires?
yeah. Billionaires and millionaires don't need Medicare.
Are they getting some tax breaks, millionaires and billionaires?
There's an offset as there's a reduction in expenses related to Medicaid and other safety net programs. There's a tax cut where those monies will be used to plug. So it's a big deal for Medicaid to be cut. So there's a work requirement that's a part of the cuts. It is also adding a work requirement. Now, the legislation would have you believe that people on Medicaid don't work. The reality is that most people on Medicaid work, but there are people who are unable to work because of some of the disabilities that they have, which Medicaid helps to provide care for. And so the idea that people are not working is a fallacy. And also, people have gig economy jobs, so they are DoorDash and Uber Eats, and they're driving Uber, and so their documentation of income is not as easy as a pay stub. And so some of the work requirements would make people who are working day in and day out in gig economies not necessarily be able to prove up those employment opportunities as easily as someone who has a W-2. And so we do know that the implementation of the proposed cuts, along with the work requirements, would be somewhat harmful. Of course, we want people to work. Able-bodied people should work, and again, the majority of people on Medicaid nationally are working. So it's just a false narrative that people on Medicaid are not working and may be lazy.
Tell some of our audience what they should be doing, whether it's contacting their, not alderman, but their probably
contacting your congressmen and your senators,
okay.
And letting them know that you're not in favor of the cuts to Medicaid. Now, in Illinois, we know that our predominantly most of our congressmen are Democratic, and the two sitting senators are Democratic and are not in favor of this big, beautiful bill on the principle, not because they're Democrats, but on the principle that this hurts people.
And keep this in mind, audience, that this is not a partisan thing that Joel is talking about. He's giving you information, telling you how to go about protecting your Medicare, Medicaid, all these things, and we must be aware of it. You were supposed to remind me to reach down in my bag of tricks, right?
All right.
And so that I can give the proper commercial. It's for a station break, right?
All right.
Station break for our sponsor, the Black Star. That's the wrong. You're supposed to help me get the right papers out.
Your bag is on the wrong side.
Wrong side, right. But I got it this time. Lindsay, I owe this to Lindsay at the Black Star Project. I'm going to make you aware of this number. 773, write this down. 285-9600. That's the number you're going to be able to call to get information about the programs that Black Star sponsors, and I'm going to give you more information about it. I've got a shout out to Lindsay and the crew, Pam and everybody else at the Black Star, and that worked on celebrating Juneteenth last weekend, that Saturday. It was a great celebration. Folks came out to Philip Jackson Parkway for it. I think we must have doubled or tripled the amount of people that now are aware of Juneteenth. And I hate to say this, and I'm not the only black person to say this, didn't know anything about Juneteenth until relatively recently. Did not know the significance of it. Now it's a national holiday. The banks are closed, and some people didn't even bother saying anything about it after previously extolling the importance of Juneteenth. But let me take this moment. This is some information that you need to know, take down, and pass on to your friends about what's happening at the Black Star Project headquarters. Okay, the first thing we'll have is on building Chicago's next CEO. Now, that's an interesting concept. Out of the black community, they have a program for, let me see the ages. I think the ages start from 10 until about 18, that they will identify people who have talent, and they will be tutored over a period of time, starting tomorrow, actually, and it's not too late to register. I gave you the number, 773-285-9600. And it'll be twice a week, Tuesdays and Thursdays, from 10 a.m. to 2 p.m. So folks don't have to be going out on the beach all the time. Spend a little time away that they can learn how to be a CEO. Then, that will be at the 3509 King Drive address on the second floor. Second thing, Ambassadors to Hope. That program started actually today, and that goes in through August 15th. Days are Mondays, Wednesdays, Fridays, 10 a.m. to 2. So don't worry about going out in the park and playing all the time. You got some time to do something that's going to gain you some value, etc. And it's also an opportunity for many of you folks to maybe volunteer. So make that phone call. Can I turn it back to you? Because you got some dynamic stuff that need to talk about. I don't know which one we're going to hit. Talk about the collaboration. Tell me about the collaboration with other nonprofits.
Absolutely.
What's the Chicago Alliance?
Chicago Alliance for Collaborative Effort. So in addition to being the CEO at TASC, I recently became the chairman of the Chicago Alliance for Collaborative Effort, which is a partnership of over 60 human service nonprofits here in Chicago who come together to form a safety net, a stronger safety net. We work with the city and the county. We serve the metropolitan Chicagoland area, child care, refugee resettlement programs, behavioral health programs, et cetera, schools.
All this is nonpartisan.
All of these are nonprofit organizations based here in the Chicagoland area. And so we come together to try and demonstrate our strength as a population to make sure that we cover entire communities. And so where the services of one organization ends, the services of another organization picks up. So we're able to serve the whole family, all of the services from cradle to senior care. And we're a powerful group. Like I said, over 60 groups, and we wanted the community to know that we exist. Sometimes it's hard to find services exactly what you need, but we're able to get together. So the organization is called CASE, Collaborative Alliance for Chicago Efforts, CACE, and our website is casechicago.org. And so we're excited to be able to serve the community, working in partnership with our city departments, the city of Chicago, Cook County government, and with the private sector. And it's our job is to really get out in front. Our collective mission of helping Chicago be stronger is what we really thrive in. And so I'm honored to serve.
You had to not fight all these other alpha male or alpha personalities to find this is a better way that we can collaborate.
Oh yeah, this is collaboration. We're colleagues and loving colleagues who work together to strengthen each other's independent missions, but our collective mission, like I said, of helping and strengthening Chicago's citizenry.
Tell me a little bit more about that you characterize as the mental health and substance abuse. And I'm curious about one thing: this fentanyl thing. Is that in the black community too?
Fentanyl.
I really don't know and understand that it's getting a lot of play. And normally, when it's getting a play, it's not because of us having it.
No,
Okay,
fentanyl
good.
is a problem,
Okay.
and so I'll say this: last weekend there were 34 overdoses in Chicago. We got an alert, a health alert, that overdoses are on the rise. There's a spike in fentanyl, but not only fentanyl. What we should also be aware of is there are other adulterants present in street drugs, and so dealers and wholesalers of drugs. We know it's not unknown that people add things to drugs to expand the profit. And so 1 kilo of drugs and a kilo of baby laxative or whatever. But sometimes those adulterants are other drugs that have negative impact on our body. So somebody may be a longtime substance user, and in addition to the strain that, let's say, the heroin is having on their system, they may find themselves in kidney failure. Or it may be phenacetin, which is an outlawed drug here in the United States that is outlawed because it impacts your kidney. But that's a known adulterant in drugs. And so there are other adulterants that our distribution and drug dealers are using. And so that's something that we should be aware of. So this past
How do
weekend...
you get the word out, Joel?
Well, we're about to launch an awareness campaign working with the Illinois Department of Human Services.
Okay.
But to understand that there was a spike and it was such a number of overdoses that the Chicago Department of Public Health put out an alert to the community saying, watch out for the drugs that you're using, that people are using. So we have intramuscular naloxone distribution site where if anyone needs to reach out to us, again, contact us through our website, we will ship overdose prevention kits to people across the state of Illinois. And including Narcan, which is used nasally to help people. You never know. People are passing out. It's not always heat. Sometimes people are using substances that may be negatively impacting their health, and so we want people to be prepared for the people around them that may be suffering and negatively impacted by substance use.
What are you looking at next that has not been talked about, but you and your groups are looking at, but is underreported or people are not aware of? What are some of the things that we should be concerned with that could be right? Besides, I know lack of inoculations. I'm worried about that myself, but go ahead.
Well, definitely the adulterants in the substances, right? So we're going to launch an awareness campaign in this coming fiscal year that's going to help our communities understand that they should definitely be aware of what's in the substances if they are indeed substance users, and try and move people into recovery from substance use. I think it's also, notwithstanding the pending budget cuts, we want to double down on
Are you talking
funding.
about state budget or city or what?
The state budget is really dependent on the federal budget.
Okay.
And so while the state budget passed, I think depending what happens with this reconciliation bill in D.C., we may find lawmakers call back to Springfield to make some adjustments to the budget. The budget that passed increases funding to substance use and mental health treatment, which I think is great. And we want to keep it that way. We want to be able to put more clinicians in the community. We want to, the city of Chicago has done a great job of adding 3 new city clinics. The first time they've added city clinics in
What part of the city?
The west and south sides of Chicago.
Mm-hmm.
And so we applaud the Department of Public Health for adding those clinicians. There's an expansion of clinicians throughout the city and private organizations like my own, but we need more. Unfortunately, roughly 70% of people who need substance use treatment are not in treatment, and that part of that is access.
70%?
70%.
Wow.
Part of that is access, but part of that is stigma. So we want to help people know that we're listening. We want you to come forward for help, and we're going to find room to help you receive the services that you need, both mental health and substance use.
Well, let me ask you, with all this talent, many of the folks are listening, different things, How do you get them involved? What can they do? What kind of talents are you or your organization, other organizations looking for that volunteer work or adding their resources would help now?
Well, I tell you, we have upwards of 30 open positions at TASC, most of which only require a high school diploma.
Say
And
that
so
again. Say that
only
again.
require a high school diploma or a GED.
What's the
And
program?
these are direct service case management positions. So anyone within earshot or watching here today, contact us, www.tasc.org. We have jobs available across the state of Illinois. We serve all 102 counties, so as far south as East St. Louis and Marion, Illinois, and as far north as Lake County. We're hiring, and there's an opportunity. Persons with lived experience of substance use, mental health, or criminal background are welcome to apply. And we're looking for people who can use that lived experience to help someone else who may be traveling down a path that they've recovered from.
Joel, thank you. Thank you so much for bringing this information.
Thanks for having me. Appreciate you.
We're going to have him back. I want those calls to come in. We will contact Joel. If you send us a call or drop a call to us, we'll be back to you. When you call that number, it won't be lost someplace it won't be lost. Somebody will call you back. Thank you for joining us today, and we're going to get even more excited with
Let's
this.
do it.
Going to have you back.
All right. Thank you.